I had been in rural practice for about a decade. There are differences practicing out in a rural area or an urban underserved area than there are being at a tertiary care hospital. The longitudinal curriculum is really just a day in the life of a physician in a rural town or an under-resourced area. We have the family medicine residents learning a little bit of everything every single week, which is kind of what a family doctor does.
In any given day, I'll have these crazy, what I call family medicine days, where I'll deliver a baby and then do a paracentesis and then prescribe a new mental health medication. These really different things that you're doing all in the same day because of this longitudinal curriculum. And you sit back and wow, I did the full span of family medicine today.
All of that fits into the curriculum. It's the training maps to what we're training for, and that's under-resourced primary care in the urban, rural, or international context.
As a family physician, you're ready to do anything at any time. You're bouncing around from different places, and sometimes it feels a little bit disjointed, but by the end of 3 years, after doing it over and over again, you realize that you're not getting tunnel vision into one thing each month, but instead you're trying to stay broad and keep your skills sharp to where you can tackle whatever comes through the door.
We're here for training, but we're also able to just kind of see how rural family medicine works and how we're able to just kind of bring everything to our patients here. Overall, it's making you just more well-rounded as a provider.
In rural Alabama, where there's not enough doctors, or in urban Alabama, where there's not enough doctors taking Medicaid or the uninsured, it is not a low-volume clinic where you're going to be looking for patients. You're going to have plenty of patient cases for your training.
You're not in the same office for a month and then moving to a different office. You can be in a lot of different parts of the community in one day, which is really a little bit more realistic, kind of the life of a full-scope primary care physician.
We also have a Bible study in which we also kind of connect to be in the presence of God during that time.
One of the things that makes the longitudinal curriculum so effective, it's authentic and mentored. If you want to live the life of a primary care physician, it's authentic. You're living that life in training, but it's mentored. The first time that you experience that broad diversity is not going to be your first year of practice. It's going to be your 3 years of training.
It's really trying to get at the diversity of what family medicine can be, and I guess what we think it should be, and to just get in those rhythms of being family medicine doctors that do a lot of different things most days.